recorded.
All right, guys, welcome to tonight's meeting. It's 6:02, so we're going to go ahead and get started. Just a reminder, if you weren't able to pre-register to speak for public comments, you can do so in our comment section. Go ahead and register. You'll need your first, last name, email, phone number, and the topic. Registered speakers will be called upon in the order requests were received. Speakers should keep their microphone muted until called upon to speak. And when called upon, speakers should unmute their microphone and turn on their web camera if possible. And once finished providing the comments, the speaker's microphones and camera should then be muted again. All right, so I'll go ahead and begin with roll call. Missy Baker. Here. Dr. Batt. Jeff Broadway.
Here.
Dr. Desai. Dr. Desai. Earl Ford.
Here.
Meg Harkins.
Here.
John Lorenzana. Jesse Lindberg. Eunice McGee.
Here.
Dr. Moss. Dr. Angela Moss. And I'm here. Dr. David Smith. David Williams. All right. So did Dr. Batt, is he here? Dr. Desai. Oh, sorry. Aniket Desai. Is he here? Okay. John is not here. Jesse Lindberg. She is not. Angela Moss. She is not. Dr. Smith. And then David Williams. And I think that just gives us 6. And 7 is for quorum. Janet, do you just want us to go ahead with everything and then we'll just skip the recommendations?
I think we just got one additional member.
Dr. Smith, was that you?
Yes, that's me.
All right, good. All right. So we'll go ahead and start off with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I'll go ahead and lead us in invocation. Our Heavenly Father, thank you for allowing us to meet here today, Lord. Thank you for everything that you've given us personally, for everything you've given us. You know, we're thankful for the board, Union County, and all the communities that we serve. Lord, please guide us and keep us in your direction tonight, Lord. In Jesus' name we pray. Amen.
Amen.
All right. Amen. So we're going to go ahead and move into the approval of the minutes. Hopefully everyone was able to go ahead and take a look at that. It came in our email from Carla. Does anyone have any questions or do we have a motion to approve?
So
This is
moved.
Missy. Motion approved.
I heard Eunice. And who was the second? Was that Missy?
It was.
Okay. All those in favor, let it known by saying aye.
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 All those opposed, like sign. All right, hearing none, we'll move forward to the approval of the agenda. Do we have a motion to approve tonight's agenda?
So moved.
Motion to approve. Second, this is Meg.
All right, and who was the first?
Jeff.
Jeff. All those in favor, let it known by saying aye.
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 All those like sign, let it known. All those opposed, let it known by like sign. And the agenda is approved. All right, any old business to discuss? And Janet, do you want to go ahead and give an executive director's report since Michelle's not here tonight?
Yes, ma'am. Thank you very much. And I will try to make this short and sweet. Can you hear me okay? So just wanted to update you on two things. One of them, well, actually three things. First, let me say happy Valentine's Day. And so with that being said, the other two things I wanted to mention are the fact that we are in the midst of the budget process now as a county and as the Human Services Agency. We have our initial, we call them SL1, but base level budget drafts have been submitted to budget as of this past week, actually as of the 31st of January. And we will be doing budget presentations and actually program presentations to the to the Board of County Commissioners. We did part of the Human Services program update this evening. The board meeting started at 3 p.m. and we also were joined by several other county departments, including finance and procurement and park and rec, presented during that time as well. So the second half of our presentations will be held at an upcoming Board of County Commissioners special meeting, which they are having those. The current schedule is once a month, so I'm not sure when the remainder of the human services programs will be able to present, but would expect that that will happen in either March or April. And from a budget perspective, I know we'll be bringing additional information to you all over the course of the next several months. The county manager and the management team will be reviewing initial information from the budget office over the coming weeks. And then once that part of the process is done, I anticipate that we will bring back to you some information about the specific asks, and then obviously what the county manager's actual recommendation will be coming later on, closer to the April and May timeframe.
And then I don't know, Janet, if you or Commissioner Williams want to share, if y'all have something to update the board on the 3 applicants that we brought to the county commissioners.
Yes, and I apologize for that. Those did go to the Board of County Commissioners it's January, and I am not looking at the date, but at a meeting in January, and they were approved. And so the clerk to the board will be reaching out to those 3 nominees, and then Carla will work with them. And Carla, you can, or Commissioner Williams can jump in, but I know Carla will complete the orientation process with them, and I would believe that they would be on board for our March meeting.
Yes,
If memory serves, I believe the Board of County Commissioners approved those 3 applicants at our first February meeting.
Thank you, Commissioner Williams.
Thank you. Is there any other old business to discuss? All right, we'll move on to the division report, and we'll start out with a COVID-19 update with Dennis.
Okay, thank you. I'll try to be pretty brief with this report. As many of you know, the last time we met in January, we were in the middle of the Omicron spike. And so we were busy looking at a lot of new cases. And in fact, we saw as many cases in the month of January as we saw all the previous 5 months. And that included the Delta surge that we saw in August and September and early October. The good news is we've had a nice drop, almost the same level of drop that we saw with the increase. We currently are above or just below the peaks of the past surges that we've had last January, as well as the Delta surge that we saw in the fall. So we're in a much better position than we were in January. So this is a average daily new cases by month, just to give you an indication of what you already know with the increased cases. We were averaging for the month of January 514 new cases, and now we're down to 189, and that's dropping each day in February. So we expect February will be considerably low as we look at transitioning sort of back to a more normal state, fortunately, with these improving COVID conditions. This is just sort of a snapshot picture that I share most months about our how we compare within our region. This is, you see the 7-day average as of today is 153 cases a day. That's a 73% drop over the last 14 days. Test positivity remains high, but it's not a very good indicator right now because the test numbers have, and test demand has decreased a good bit. Many people who are seeking tests are oftentimes confirmatory and or they're symptomatic, and so there's a high likelihood of being positive. But we had gotten up to 40%. It's now dropping slowly, but it is dropping pretty steadily in our region and across the state. Everything's looking favorable with our current picture. This is just an indication of our testing of Union County demand. You can see the bar chart shows a pretty sharp drop over the last several weeks, as well as the drop in the percentage of positives. Deaths have been, while they went up a little bit, they were not nearly as steep as the cases were, and that's a pattern that we've seen nationwide as well as statewide, which is a good indicator there that it has stayed and remained relatively mild in most cases. Hospitalizations, again, have shown a nice decrease here over the last several weeks. The pink bar at the top is the Metrolina Healthcare Preparedness Coalition, which is essentially the Charlotte metro region, and you can see that the drop is nice in its drop. There's not a whole lot to say in terms of COVID vaccinations. The numbers remain pretty much the same in terms of the percentages. We're still about 54, 55% fully vaccinated in Union. And you can see how the other counties fare in that regard as well. Two big things that recently happened, and I'm sure folks are already aware of, but I'll just make note of it. On February the 7th, contact tracing and quarantine in schools and childcare settings, in schools, was discontinued by Union County Public Schools Board of Education. That was came on the heels of the joint resolution that was passed by the commissioners and the school board. That went into place on the 7th. On February the 10th, North Carolina Department of Health and Human Services discontinued contact tracing and quarantining in schools as well. That was going to be in their communication effective February 21st. So essentially, the state has also taken those steps. The other thing I want to share is that fortunately, those changes will also be applying in childcare settings, which was becoming very, very challenging and troubling because of the challenges for contact tracing and just repeated exclusions in the childcare settings. So we were very pleased to see that is now going to be or has now gone away. So essentially, folks who are positive or cases, and they're the ones who now are just excluded. The isolated cases who can return for the most part 5 days after testing or onset of symptoms, as long as they are asymptomatic and symptoms have been improving, they can return after 5 days. That's a general guidance now for isolation for the general population. So all in all, with 14 days into the month of February, we're pleased to see things improving, and certainly expecting it to continue to do so as we kind of look at sort of further transitioning away from just counting numbers and kind of monitoring this on a little different basis as we move forward. I was on a call with the state this morning, and that's something that they're looking at closely as in terms of what our next transitions are for COVID. Obviously, we want to continue to monitor new variants that would arise, but this nice drop in cases is very refreshing. So that's all for COVID. I did want to share one thing with the group here, and Stephanie can comment if she would like, but every 3 to 4 years, we do a community health assessment, and we are doing one this year in conjunction with Novant and Atrium. As we have in the past, it's a joint effort. I would encourage you to complete this survey, share the information, take a picture of this QR code, and complete this online. It's mobile friendly. This is a way for us to understand what people feel are concerns in the community regarding the health status, and from this, it helps us in looking at our prioritizing our work here at Human Services on a broad basis. So I would encourage you all to complete the survey. And that's all that I have.
May I add one thing to that, Dennis?
Please do so.
Just with the survey, in addition to you all, and Dennis asked to share it, we are looking specifically for 2 different groups of people: teens ages 13 through 17 and adults ages 18 and older. So if you have teens in your family or in the community that you know and have the ability to engage them, that would be awesome. I will put a link to the page that these surveys are on the Union County website as well, so that can be accessed. I'll put that in the chat.
Thank you, Dennis. Thank you, Janet. Does anyone have any questions for Dennis before we continue? All right, so next we have Environmental Health Division fee recommendations with Tracy Colley.
Good evening, everybody. And I'm noticing my camera is kind of going in and out, so if you lose the visual, I'll just keep talking as long as my microphone continues. So I have several environmental health fee recommendations to present to you this evening. And if you vote to approve them, run through the list and give kind of a brief summary, talk about the fee, and then, if you have any questions as I go along, please feel free to ask them. The first fee is a lodging facility plan review fee. And this fee is for the review of plans for construction of new lodging facilities or renovations to existing commercial lodging facilities. In Union County right now, we presently have 20 lodging facilities. That's hotels, motels, inns, and bed and breakfast facilities. With the increased trends in commercial development, particularly along the western side of Union County, we are anticipating additional lodging facilities. Right now, we have no fee for plan review of this sort. In comparison, plan review fees for lodging facilities are charged in Rowan, Caldwell, Anson, Lee, Franklin, and of course Mecklenburg. Just to give you a comparison, we are asking for a fee of $250, which is very comparable to others. Meg is asking, are Airbnb type homes required to be reviewed? And the answer to that is no. They are not reviewed as inns or bed and breakfast unless there are 4 or more than 4 rooms rented out for pay individually. And then, of course, as part of a lodging facility plan review fee, if they are plan review, if the facility has a separate food service establishment with it, that would be a separate plan review and a separate fee. So that's handled separately. The next fee for your consideration is a temporary tattoo artist permit fee. This fee would allow tattoo artists to operate in Union County at an approved location for 15 days or less. We're receiving a lot more interest in this type of fee. This is a fee that's charged in other counties. This would allow an artist to come to Union County and tattoo on a short-term basis in an approved location that has public restrooms, hand washing sinks, an autoclave, so forth. So the annual fee for a tattooing permit now is $200. So this would reduce the fee for a temporary artist, because they're just operating for a shorter period of time, to $125 per permit. And again, that would be a shorter duration of time. Last year, just to give you an idea, we permitted 62 tattoo artists in Union County. And of those, approximately 22 would be classified as a temporary tattoo artist, coming into Union County and then maybe going back to their base of operations or another county. But they do have to satisfy the North Carolina rules governing tattoo facilities. The next fee I have for you is the on-site wastewater system component replacement fee. It's kind of a mouthful. So basically that fee is charged when a component of a septic system is replaced. And this isn't a fee for repair. This is just a replacement of just a component due to most often like a building expansion that encroaches over a tank, or some other type of construction or landscaping, a detached accessory building, garage, a deck replacement, something that encroaches into the setback of a component of a septic system, or may necessitate the replacement of a component to allow for construction. We already have a repair fee that's a little bit different. So this would allow us to correctly classify a replacement fee for a component. And we're asking for $100 for that fee. The next fee we have is the land use plat review fee. Land use plat reviews is something that environmental health does already, and we have been doing for quite some time. We're doing more and more of these, not only for unincorporated Union County, but also municipalities such as Unionville, Indian Trail, Town of Waxhaw, Monroe. And what we do with these is we evaluate parcels for subdivisions, and that's subdivisions that are served by water and sewer, or septic systems and or wells. We look at commercial development, rezoning requests, and for the development of the property. So we look for existing septic systems on site. We look for existing wells for abandonment. We look to determine if there's an existing easement in place. We look for potential sources of contamination, such as underground storage tanks or previous contamination that may affect the use of the property, and that sort of thing. So the fees that we're proposing for this are very modest. I would estimate that the time to conduct a review ranges from 15 minutes for a very simple one, up to 30 minutes to an hour if there's extensive document searches, communication with the applicant or surveyor or the developer. For a subdivision review, up to 8 lots, we would charge $15 per submittal. 9 to 25 lots, that would be $35. 26 lots and more would be $50 per submittal. For revisions, we would charge no fee for insignificant changes. That would be for a plat that needs additions, deletions, or corrections to a text. If there are minor changes needed, such as we need them to add land use features, such as an on-site wastewater system or a well, or a known identified source of contamination, that would be a minor change to a submittal. Or a major change, we would charge $25 for that. And that would be something significant, such as a property boundary change or an easement configuration that was left off the submittal. Then for rezoning or commercial development review, we would charge a flat fee of $25 for that. The next fee is a well permit redesign fee. That is a fee that's charged if there's a significant site change to a well permit that's already been issued that necessitates the revocation of the well permit. So an example to that would be a house site being relocated, placement or relocation of a detached structure, change in a property boundary location. So something that also would trigger this fee would be at the request of a property owner after a well permit's been issued. So this typically requires a site visit. There's no need to charge a full well permit fee because the original fee at $480 includes the water sampling that's included with a new well installation. So this fee just gives us the ability to obtain some fees to recoup our costs for site visits and the cost for redesign of the well permit. And we're asking $125 for that fee. The next fee is a refund processing fee. So this fee would be charged when refunds are requested after a service request has been submitted to environmental health and administratively processed. This refunds are not given for services that are already rendered or site visits that have been conducted. So if I could just kind of paint the picture for you of when a work request is submitted to environmental health, let's say for a compliance inspection, the inspection of an existing septic system, that request would come in from a customer and be reviewed by administrative staff for completeness and correction. And then once it's deemed correct, we would bill them for payment. Once payment is received, it would be that work request would be processed through the environmental health system, assigned to an environmental health field staff person, and they would put that in the queue and communicate with this property owner or applicant for, let them know what the time frame for completing that request is. When that refund request is submitted, it comes to typically to the environmental health specialist. They make sure no actions have been taken. The request comes to me for approval. And then our administrative staff prepares a memo requesting that refund. That request goes to the Union County Finance Department, and they issue the refund typically within 2 weeks. So you can see that a work request coming into environmental health passes through a number of hands before it's, a refund is even requested or processed. So that we're looking to charge a $25 refund fee, processing fee for refunds when they're requested after an environmental health service request has been submitted. Now, there are occasions when someone changes their mind almost immediately and we're able to stop payment on a credit card. We wouldn't charge this fee for something like that. This is for something that's already been a request that's already been processed through our system. So those are the fee requests that I have for you this evening. I'm happy to answer any questions that you may have.
Does anyone have any questions for Tracy? All right, if not, she is asking for approval of the Environmental Health Division fee changes and to recommend their submission to the Board of County Commissioners for adoption with the fiscal year 2023 budget. Does anyone want to make a motion to approve?
I'll make a motion to approve.
All right. Do we have a second? A second?
Yes, I'd like to second it.
And then I'll do a roll call for the voting. Missy Baker,
Approve.
Dr. Broadway,
Yes.
Earl Ford,
Yes.
Meg Harkins,
Yes.
Eunice McGee.
Yes,
Yes.
yes,
Megan Shaw, yes. David Smith, yes.
Yes.
And then David Williams.
Yes.
Okay. And then the motion is approved. And we will move on to the next part of our division report for approval of. You're welcome. We'll move on to approval of requested public health clinical service fees with Jackie Morgan.
Good evening, board members. I'll be brief with this. So Public Health is asking for the review and approval of an additional 6 fees to be added to the agency's Division of Public Health fee schedule. This, as with all of our previous fees, they will receive reimbursement from Medicaid, Medicare, commercial insurance, and HRSA for these requested fees, with the financial impact of the fees offsetting the agency's covering of clinical costs for several areas, including and associated with COVID-19 immunization clinics and COVID-19 testing. The fees, there are new fees for a Pfizer booster, a J&J booster, Moderna third dose and a booster, and 2 pediatric first and second doses for the Pfizer vaccine. And just as a point of reference for you, I thought you may be interested. So far this year, we have given 61,329 total doses through the Division of Public Health of vaccine for COVID, and 2,194 of those were pediatric doses for children 17 and under. We have billed in COVID revenue to date 705,735.77, and of that, 180,964 was HRSA money. So that's our revenue to date, the number of shots that we have given, and the ask on the table is for approval of those new 6 fees to the fee schedule, mostly boosters, 2 being pediatric.
I'd like to make a motion to approve. I want to ask a question too, Jackie.
Yes, sir.
The boosters, is there any information yet as far as when a second booster may be needed?
I am going to defer that to Michelle McGrath, who's on the call. If there's anything clinical, I told her I would have her answer that.
Hey there, Mr. Ford. There is information coming very soon. We actually got a notification about that today, that they're for immunocompromised individuals, they will be recommending a 4th dose or a booster after the 3rd dose. But we have not implemented that. It's not, we still have more information to gather, so it should be pretty soon.
Thank you.
Does
All right,
anyone
so
have
Earl-
a second?
Oh, go ahead.
I was just asking if there are any other questions.
All right, so Earl made a motion to approve the fees. Do we have a second?
Yes,
I
I'll
wanted to
second.
second. This is Meg. Sorry, Eunice.
That's okay. That's okay.
All right, and I'll do roll call for the voting. Missy Baker,
Approve.
Jeff Broadway,
Yes.
Earl Ford, you made the motion.
Yes.
Meg second.
Approved.
Eunice,
Yes.
I say yes. David Smith, Dr. Smith, David Williams.
Yes.
All right, and the motion is approved. And that wraps up our division report. We'll move into our announcements, and I'll just start at the top and go around. Let's see. Tracy, did you have anything else you wanted to update us on with environmental health?
The only thing I wanted to mention was there was a public comment period for the Catawba New Indy plant issue related to the hydrogen sulfide issue that was affecting kind of primarily the Waxhaw, Weddington area of Union County, some areas of South Carolina and Mecklenburg. The public hearing went well. However, there were a number of concerns expressed due to additional contamination issues that the EPA was going to evaluate. So they extended the public comment period to, I believe, March 11th. So I just wanted to make everyone aware of that.
Thank you. Jackie, do you have anything else to add?
No, ma'am. Thank you.
Thank you. What about transportation? Teresa?
I don't have anything today. Thank you.
Michelle McGrath, do you have anything to add?
No, I don't. Thank you.
Dennis?
I will just make folks aware that you will recall that we were funded for a veterinarian position in this year's budget, and part of that that function for that position is going to be kind of a shared three-legged stool, so to speak, working closely with animal control, animal services that's under the sheriff's office, and also working in consultation with Cooperative Extension and the folks out at the Ag Center, particularly with a lot of the large animal and farmer community, as well as working in public health with some of the vector-borne and animal-related public health issues and concerns that come up from time to time, particularly as it relates to oftentimes the communicable disease world. And so we're very fortunate. This is actually a cutting edge kind of a position because there's, I don't think of another one like it across the state. So we're fortunate to have it. And I wanted to announce that we've gone through the recruitment and interviewing process, and our very own Dr. Jeff Broadaway is going to be accepting that position.
Oh, that's great.
Having a start date of mid-March, but I wanted to make y'all aware of that and give Jeff just a moment if he wanted to share any comments.
Geez, I wasn't told I had to make any comments. Certainly is a challenge, and I'm looking forward to it, and I think it'll benefit the county residents in many different ways, and which is what we're all here for, right? So I'm certainly looking forward to working with Dennis and Michelle and the rest of the staff, and which I guess means the next meeting, which hopefully will be in person. I guess my understanding is I'll have to step away from the board. I'm looking forward to it. It's going to be a challenge and a change, and certainly it's amazing what opportunities come available. So if there's any questions, I'll be glad to help any way I can, and look forward to seeing how this unrolls.
Thank you, Jeff.
Congratulations.
And it may be, based on the time frame, you may still be good for one more meeting in March, I believe. If the meeting is before your start date, you still would be okay. But subsequent to that, you would need to roll off. That's all I have, Meg.
All right, thank you, and congratulations, Jeff. All right, we're going to move on to Michelle Marcano. Do you have anything with Veteran Services to share?
Hi, good afternoon, everyone. I don't have anything from Veteran Services. We are doing really well, but I did want to actually just give a shout out to my coworkers at DHS, the directors. We have literally sped through all speeding limits to get to this meeting because we just left another meeting. So it was a big joke, are we going to get there on time? Can we do it? Can we do it? Can we do it? So I just want to, again, reiterate Jackie and some other people also mentioned at the board meeting that, we're thankful for the people that we work with, and we absolutely are, and we're thankful to be employed by Union County.
Well, y'all did good to make it, and thank y'all, everyone, for making it on Valentine's night. All right, let's see. Janet, did you have anything else to add?
I do not have anything else to add.
All right, Stephanie?
I think Dennis really talked about it, but just want to reiterate, we need more surveys. We have just over 1,000 now, 1,005, but we want to get a lot more. So please take the survey, get the survey out to friends, neighbors, and everyone in the community, because we want to hear your voice.
And I like having the QR code for the survey. Appreciate that. And last but not least, Ashley.
Hey everybody, I wanted to congratulate Jeff and also let him know that I hope that means he's handling all dangerous dog hearings from now on, because I know he loves those. And the second thing for me is that I'm going to follow along Dennis's line. We, in last year's budget, were approved to hire an in-house attorney that would handle child welfare issues that arise where we have to go to court on behalf of our foster children and children that we are investigating for abuse, neglect, or dependency. And I'm happy to report that we are well into that process of hiring an in-house attorney who will, once hired, begin the learning process under Dalan, who has been our contracted DSS attorney for many, many, many years. I know she's been there for a while. She did my kids' adoption before I was DSS director. And so I know that this person that we bring on board will have a lot to learn, but I am looking forward to having someone in-house that will be able to carry on in the future. So that's all I have. Oh, my last plug, as always, I always and forever will need new foster parents. If you know someone, or if you're listening to this meeting, or if you watch it when it's recorded and know someone who has a heart for children and wants to give back to their community and has room in their family for a foster child, please reach out to me and I'll get them in touch with our social workers.
All right, we're going to go ahead and move into the public comments. We do have one person registered to speak during public comments. The speaker must begin their address to the board by giving their name, stating whether they are a resident of Union County, indicating their municipality within which they reside, and stating the topic about which they intend to speak. The speaker will have 3 minutes to make remarks. The speaker cannot yield any of his or her time to another speaker, and the speaker must be courteous in their language and presentation. Personal attacks will not be tolerated. So, Harold Shoemaker, you are our speaker for tonight.
All right, thank you. You guys would have more speakers if you put this at the beginning. Seems like you guys don't want to hear from us. I want to talk to you about choice. To the commissioners that stated they were for choice when approving the $335,000 for increasing childhood vaccination, and to those on this board, I ask a simple question. What is the difference between choice and informed consent? Are parents clearly being told of the risks? Are you telling parents that this is different, that the Pfizer has complete immunity with emergency use authorization? Are you telling about the very real myocarditis risks among many other risks? Are you telling them they're not getting the approved version that carries liability for Pfizer? And then other topics, when businesses say get this shot or lose your job, is that choice? When governments say get this shot or your travel will be restricted, is that choice? The way choice is being used is really a replacement word for coercion. Informed consent means you are told of all the risks and you have to give consent. Informed consent also means you cannot be forced or coerced. Safe and effective means don't ask questions, just take it because we deemed it safe, and you should risk your health for our interpretation of greater good. Safe and effective is the opposite of informed consent. One of the stories I heard, a pregnant woman was told by her healthcare providers she should get the shot while pregnant because she doesn't want to get COVID while she's pregnant. She was not told about the risks to her unborn child. The shot, since it's emergency, does not have an insert like approved drug, and so no risks were explained. She lost her child because she was in effect coerced by her healthcare provider she trusted, but she was not allowed informed consent. There are thousands of stories like this. Our healthcare system, which claims to operate by do no harm, has crossed the line. We are now operating instead by profitable harm is necessary. The original, little history for you, the original smallpox vaccine was unusually harmful vaccination that was never tested for being adopted. It increased rather than decreased smallpox outbreaks. As the danger and inefficacy became known, increasing public protests developed towards vaccination. Yet as smallpox increased, governments around the world instead adopted more draconian mandatory vaccination policies. Eventually, one of the largest protests of the century occurred in 1885 in Leicester, England. The government was replaced, mandatory vaccination was abolished, and healthcare measures that were rejected by the medical community were implemented, like hygiene and quarantine the sick. These measures were highly successful and once adopted globally ended the smallpox epidemic, something most erroneously believe arose from vaccination. An 1874 quote from Emeritus Professor F.W. Newman encapsulates the mood of the time. Decorous and admissible language fails me in alluding to that which may have seemed incredible 30 years ago. The commanding of vaccination on a second child of a family
Time's up.
when vaccination has killed the first, and then sending the father to prison for refusal.
And that's time. Thank you for sharing. And that wraps up everything on our agenda for tonight. I do appreciate everyone joining us on Valentine's night, almost 7 o'clock at night. I appreciate it. And thank you for being patient with me for my first meeting, helping lead a little bit. Do we have a motion to adjourn?
So moved.
Second.
Yes. All those in favor, let it be known by saying aye.
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 All those opposed. And y'all have a good night.
You too. Bye-bye.